Hello, everyone, and welcome to another round of Family Feud. Today is a very special day as all the questions will be about leukemia and all the proceeds will be going to St. Jude's Research Foundation. We have three guests from Concordia Nursing School, Aiden, Callista, and Danny. They're here to give us some in-depth information on leukemia and why it's important for nurses to understand the disease. So come on, guys, tell me exactly what is leukemia.
Leukemia is a cancer of the white blood cells typically found in your bone marrow. You have two categories of cells in your bone marrow that leukemia usually affects. That is your lymphoid progenitor cells, which grow to become T or B cells, or your myeloid progenitor cells, which grow to become red blood cells, platelets, or granulocytes, such as neutrophils.
There are 4 different types of leukemia: ALL, CLL, AML, and CML, which again are grouped based on what cell linkage they affect.
ALL stands for acute lymphoblastic leukemia. CLL is chronic lymphoblastic leukemia. AML is acute Okay, guys, I got it. Myelogenious leukemia. And CML is chronic myelogenious leukemia.
Wow, that's a lot of information. Well, to help better understand leukemia, we are going to ask more questions centered around leukemia and its effects on the body. First question: which type of leukemia is the most common and who is more affected by it? ALL, CLL, AML, or CML?
So I believe the most common type of leukemia is acute lymphocytic leukemia, and children are more affected than adults.
Yes, that's right. ALL is the most common type of leukemia. Great job. Now let's move on to the next question. What are the signs and symptoms of acute lymphatic leukemia? Anemia, fatigue, weakness, dizziness, dyspnea, pale skin, or all of the above?
Well, I know anemia is a sign of ALL, and the symptoms of anemia include fatigue, weakness, dizziness, dyspnea, and pale skin. So I think the answer is all of the above.
That's correct. Great job. Now let's see if I can stump you on the next question. What aspect of the head-to-toe assessment would be most helpful when caring for a patient with leukemia? Cardiovascular, pulmonary, abdominal?
Is it the pulmonary assessment?
I don't think so. Why doesn't somebody else give it a try?
The most helpful assessment would be an abdominal assessment because leukemia can cause spleen or liver enlargement, also known as splenomegaly or hepatomegaly, which can put pressure on the stomach and cause abdominal pain, loss of appetite, and or weight loss.
Oh.
What types of tests are done to diagnose leukemia? CBC with differential bone marrow biopsy, PCR, or all of the above?
Ooh, I think I know this one. Isn't it the bone marrow biopsy?
I guess we hit the brain busters early. Does somebody else want to give it a try?
You were on the right track, Danny. The correct answer is all of the above. A CBC with differential is done to diagnose ALL, CLL, and CML. An unusually high white blood cell count is a diagnostic sign of ALL In lymphocytosis with a white blood cell count of greater than 20,000 is a diagnostic sign of CLL. A bone marrow biopsy is used to diagnose ALL, CLL, and CML. A bone marrow lymphoblast count of over 20% of total white blood cells is a diagnostic sign of ALL. Excessive numbers of abnormal lymphocytes in the bone marrow, called smudge cells, is a diagnostic sign of CLL. A PCR is done to look for genetic and chromosomal abnormalities to diagnose AML and CML.
I guess that makes sense.
These are the big questions. Hope you can get them right. Exposure to what kind of chemicals can put you at risk for developing chronic lymphoblastic leukemia? Is there herbicides and insecticides including Agent Orange, chlorine, acetaldehyde, fluoroquinolone, or methamphetamine?
I know that one. It's herbicides and insecticides, including Agent Orange.
That's correct. At least somebody knows what they're talking about. Last question of the day. A patient's blood test comes back showing lymphocytosis. The doctor orders flow cytometry to be performed next and requests another blood sample from the patient. While drawing the patient's blood, the patient asks the nurse, "I don't understand why you need another blood sample. Did the first blood test say that I was positive for cancer?" What is the best response from the nurse drawing the patient's blood? Yes, and this test will determine what kind of cancer. B, no, you do not have cancer. C, no, the next blood test will determine whether or not you have anemia. D, we are not sure yet. And this next blood test will determine whether or not you have CLL, a specific type of leukemia.
I think the correct answer is the first one. Yes, and this test will determine what kind of cancer.
Does somebody else want to give it a try?
The correct answer is actually the last option. We aren't sure yet, and the next blood test will determine whether or not you have CLL, a specific type of leukemia.
Oh, okay.
Now we have two more celebrity guests coming on to talk a little bit more about leukemia.
Hi, Harvey. How's it going? I have a little bit to say about
Thank you,
leukemia.
Mike. Thank you, Steve. I have something important to say about leukemia. It's important. Acute lymphoblastic leukemia has a 90% survival rate for children.
Thanks, Donald. It also has a 20 to 40% survival rate for adults. Diagnosis of ALL includes a biopsy of the bone marrow that shows hypercellularity and over 20% being.
It's okay, Mike. I can take it from here, with over 20% being from the lymphoblast lineage.
All right. Big round of applause. Donald Trump, Mike Tyson, Aiden, Callista, and Danny. Thank you for coming and being here and talking about leukemia.